Good evening. How are you? I realize that this is been a difficult time for you. You were admitted last week into the Katie Cares intensive unit for a medley of things. We have you down for collar, nervous exhaustion, and hysteria. Also, general malaise. Okay, so, and we've been keeping track of your vitals and doing some tests every few days, and you've been slowly getting better, but the progress isn't as rapid as we hope. So we did give you a new IV bag with more intense hydration and electrolytes, and hopefully that's going to make a difference. Okay, how are you feeling right now? On a scale of 1 to 10, how would you rate your pain? Okay, it's about a 6. Okay. I'm just going to ask you a series of questions just to validate your family history and see if there's anything from that that would help me diagnose you further. So, do you have any history of high blood pressure? No. Hypertension? Thyroid problems? Metabolic disorders? Okay. Lung or heart disorders? No. And this is in your immediate family, so even grandparents? No. Okay, good. Generally healthy. Can you verify the date it is today? Okay, good. Can you verify the year? Good. Okay. And are you taking any medications on a daily basis? Okay, how many milligrams? Okay. All right. So, and you're still feeling pretty exhausted and hysterical. Okay. Well, I'm just going to perform the routine checkup that I'm going to do every couple hours today, as long as my shift is. So just relax and try to close your eyes if you want to, and really focus on resting. Okay. We want you to get better. Okay. 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 So, just take some normal breaths for me. Don't focus on breathing deeply if you don't want to. Just breathe normally. I'm listening to your heart, also your chest for any signs of congestion or fluid buildup. Okay. Okay. Great. Your heartbeat does sound regulated. I'm going to flip over and listen on the bell side. Okay. No S3, only S1 and S2. I don't hear any murmurs. All right. Actually, take a deep breath for me. Okay. Great, no extraneous noises in the chest. So now I'm going to listen to your lungs. Just take a deep breath for me this time. In, 2, 3, and out, 2, 3. Good. And in, 2, 3, and relax. 2, 3. Beautiful noises. Okay, go ahead again. In, 2, 3, and relax. 2, 3. Good. In, 2, 3, and out. 2, 3. Well, that sounds perfect. I'm not worried about that. So, okay. I know when we admitted you, you were having some hyperventilation. Obviously, that's not going on right now, but has it happened in the past few days? Okay. Have you woken up with shortness of breath? Very good. Okay. All right. I'm going to go ahead and get your blood pressure next. Okay. Okay. So I'm going to go ahead and use this arm, just sliding it up right here. Just relax. Make sure your legs are uncrossed for me. Okay. Okay. All right. Okay, so that's 110/74, which is perfectly fine. Really good sign that you don't have a high blood pressure. So I'm very pleased with that. Let me get your oxygenation and also your temperature. So just give me this finger right here. Okay, and just hold it. Spread your fingers for me. Good. Okay, and your temperature. Okay. You're at 100 degrees, so it's a little bit high. Let me go ahead and feel your forehead. Okay, it doesn't feel warm to me, but I'm going to write that down. It could also be the device, so I'll take a measurement later on. Your heart rate is 80 beats per minute. Oxygenation is 99 at room air, so both are excellent. Okay, I'm going to do some inspections on your head. I'm going to be doing palpations, feeling your face, running some sensory tests. So do you mind if I sit down by your bedside for that? Okay, very good. Okay, thank you. If you could go ahead and open your mouth for me, I just want to take a look inside. Okay. Tonsils look healthy and moist. I'm not seeing any swelling. No abnormal nodular activity. Okay, very good. All right. Okay, so I'm just going to be palpating the face. You can stay absolutely still. Just feeling for any sign of swelling. Okay. Okay. And let me know if you feel any pain at any point. So when I press here against the forehead, do you feel any pain or swelling or soreness? Okay, what about here on the cheek? Okay, pain here? Okay. Okay, stay still. Thank you. I'm going to feel your lymph nodes now. Just going to be grabbing right underneath the chin. Okay. Feels pretty normal. Open and close your mouth, please. Okay. No clicking or popping of the jaw. Preauricular lymph nodes are non-palpable. Let's check your post-auriculars. They're also non-palpable. Okay. How does your facial muscles, how do they feel right now? Do you feel tired? Is it a struggle for you to move the muscles of your face? Okay. I'm going to just do a series of brief tests just to see. They're called myotomes. So I'm going to place my hand gently on this side of your cheek. Try to turn your head all the way to this side. Okay. And 3. So resist my push. In 3, 2, 1. Okay. That was a little weak. Was that the hardest you could go? It was. Okay. All right. I'm going to do the other side. So 3, 2, 1. And turn. Okay, that right side is a little bit stronger, so that's good. I'm going to place my fingers directly on your chin. Try to look up at the ceiling for me, okay? 3, 2, 1. Good. Okay. I'm going to place my hands right underneath your chin. Try to look to your chest. 3, 2, 1. Okay. Bridge of your nose, just like the cheeks. Try to turn your head. 3, 2, 1. Other side. 3, 2, 1. Very good. Was that difficult for you? Any soreness at the face? Okay, now raise those eyebrows for me. You have really good eyebrows. Very good. Try to lower them in 3, 2, 1. Okay, now keep them low like you're frowning. Good. Try to raise them in 3, 2, 1. Okay, again, that left side was a little bit weaker, so I'm going to take note of that. Any numbness Okay, the face. Great. Great. I'm going to just be looking at your skin, see if I see any signs of redness. Okay. Nothing concerning here. Your skin looks well perfused. Well, it's a bit pale, but you have been inside for several days. Is your skin usually pretty pale? Okay. We might do some blood tests later to make sure that there's no iron deficiency going on. Okay, but I'm not worried about the texture of the skin. I don't see any sort of infection or irritation. Could you turn a little bit this way? All right, I just want to get right in front of your ears. Okay, very good. And this way? Okay. Excellent. Okay. I'm going to do a neurological test called sharp or dull. So this is going to feel like a sharp sensation. Do you feel that? Kind of like a poke? Okay. And this, go ahead and say soft. So sharp or soft? Do you feel that as kind of soft? Okay. Close your eyes for me and let me know which sensation you feel. If you feel a pressure but you can't differentiate between the sensations, please let me know that too. Okay. Yes. Mm-hmm. Good. Okay, so you couldn't tell, and that was on that left side. What about now? Don't try to guess if you can't tell, just... Okay. Loss of sensation on the left side. Also some muscle weakness. Okay, I might order a CT scan and an MRI as well. Okay, although we did that when you checked in and it was all normal. Sorry, go ahead. Good. Okay. Good. Okay. And can you tell me what side of your face do you feel the sensation? Left or right? You don't have to say sharp or dull. Good. Mm-hmm. Yes. Okay. Pretty happy with that. All right. Okay, so this is a cold globe. This time it's going to be warm or cold, and it's going to be on your face again. I just want to be able to tell if that left side is having difficulty with temperature as well. So close your eyes. Is that warm or cold? Okay, what about now? Okay, so you got a lot of those on your left side wrong. Okay. Okay, just real quickly, I'm going to just run this brush through your hair to make sure that you're not having any kind of infestations. This is completely unrelated to your reason for admittance, but there has been a lice outbreak on the floor beneath us, so we just want to stay on top of that. Any itching of the scalp? No. Okay, so just relax. Okay, just gonna look right here. little bit of dandruff. Don't see any lice or nits, so that's good. Okay. Do you get dandruff on a regular basis? Sometimes. Is it more of a seasonal thing? Okay. All right. I'm going to just measure some of your face just to make sure that it's, well, I'm going to measure your face to look for signs of asymmetry, drooping of the eyes. I don't see any visible signs of drooping. Here. Look straight at me. Okay, I don't see any visible signs of drooping, but just because you're numb on that left side, it's good to measure. So relax. Okay. 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 All right. Okay, forehead is, so that adds up to 6 inches. 3.5 on left. 2.5 on right. Okay, just your nose here. Try to stay still for me, okay? I know this is a little tedious. That's 2 inches. Just down by your cheek. Okay. All right, and I'm going to measure that again. Just try to hold still. That's 4. And 4, so symmetry of the chin. Okay, I'm just going to measure your eyes. It's 1.5. The same. Okay, 1 and 1. You have perfectly symmetrical eyes. That does not happen a lot. Okay. Very good. Okay. Let's see. Let's see. Did I forget anything? Just the eyebrows. That's 1. 1, good. Just gonna do the eyebrow to eyelid. Okay. Beautiful. That's exactly what we're looking for. Okay. So, not anything too alarming. So, I'm gonna go ahead and look at your eyes and your vision, okay? How is your vision? Any blurry vision? Seeing double? Okay. Just gonna look inside your eyes. Okay. Okay, so your pupils are round and reactive. I'm not seeing anything. I'm not seeing any signs of irritation or infection. Just keep your eyes open for me. I'm just coming a little closer. Okay. Very good. Not too worried about that. I'm going to look at the other eye. Okay, very healthy corneas. No jaundice or redness. Don't see any signs of dryness either. So that's very good. I want you to take a look at this light for me and just follow it. Just this light wherever it goes. And keep your head completely still for me if you can. Okay. Okay. Your left eye is showing a little bit of slowness too in reaction time. Okay, so go ahead and keep looking. Okay, I'm going to cover your right eye actually, and I just want you to look at me with your left. Okay. Sorry if this is making you dizzy. I'm just trying to determine. Okay. And you said you didn't have any trouble seeing out of that eye. Okay. I'm going to cover your right eye. How many fingers am I holding up? Okay. Now. Okay. Now. 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 Okay. Okay. All right. So let me know which fingers I'm moving, your left or your right, okay? Good? Good? Yes. Good. Okay. Okay, and which fingers are further away, left or right? Okay, which are further away, left or right? Okay. So next I want you to let me know when my fingers enter your field of vision, okay? Say now. And look straight ahead. Find a focal point like my nose. Say now. Good. Say now when. Good. Say now. Okay. Very good. Okay. This is a Snellen chart here. Have you had any problems reading in the past few months? Okay. So why don't you read this bottom to last row? Okay. Now, can you read it with just your left eye? Close, not quite. What about now? Can you see them all? Okay. And then what about this third row down? Those 3 letters? And can you read them backwards? Okay. And again, just with that left eye. O, the one starting with O. Okay. That last one was an F, not an E. So having a little bit of struggle with that left eye. So I'm not quite sure what that means, but I'm going to take note of it and I'm going to show it to some of the other staff. Okay, so with both eyes, can you read this? Okay, what about when I bring it closer? Can you read this last row? And then this row again, and then this last row. Okay, and when's the last time you had an eye exam? Okay. Just on a personal note, I think you might be due for one. Can you identify this color? What is it? And this color. Very good, okay. And which circle is larger? Number 9 or number 6? Number 6 or number 5? Okay. Number 4 or number 7? Okay, just keep looking straight at me. Okay. Okay. So, next I'm going to take a look inside your ears. Okay, so go ahead and turn this way for me. Just going to look inside your ear. Okay. Okay, your tympanic membrane is barely visible. You have a lot of wax buildup, but it's very common. So, it's a nice pearl gray, but you know what? I'm going to just do some cleaning of the outer ear. Okay. Just going to get in there and see if I can wipe away some of that debris just so I can visualize it better, okay? Do you have any difficulties hearing? It might be just the wax, okay? Okay, go ahead and turn. Yep. Okay. All right. Look again. There we go. That's a nice and healthy. Oh, good. You can hear better. Okay. It's a nice tympanic membrane. Don't see any irritation, scarring, or damage to the ear canal. So everything looks good with your ear, with that ear. Let's go ahead and look at your other one. Okay, this one has less wax. No scarring or scratching. Looks pretty good to me. Okay. All right, your ears are healthy. Let me go ahead and make some rustling sounds on either ear. Why don't you let me know which ear you're hearing the sounds on, okay? Right or left? Close your eyes, close your eyes. Okay. Good. 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 Okay. I'm gonna whisper just a few things in your ear. Repeat what you hear after me. Close your eyes. Circle. Square. Potpourri. Jacuzzi tub. Sunroom. Furnishings of the 80s. Katie ASMR. Very good, okay. And this is a tuning fork, so I'm just going to be making a sound, placing it right underneath the ear. You're going to hear a very weird vibration sound. Let me know when it stops, okay? I'm going to place my hands here. It's going to stop, so say now. Good. Mm-hmm. Good. All right. I'm going to be humming at a little bit higher of a frequency. Let me know when the sound that I'm making stops, okay? Very, very good. Okay, I'm not concerned with your ears. Okay, so next I'm just going to palpate your neck here, making sure there's no swelling of the neck. Relax. I didn't get to palpate the back of your head, and I just want to check continually for signs of a latent concussion that maybe we missed when you first entered, especially since that left side is having some, a little bit of numbness. Okay, so relax. Okay. I'm not feeling anything. Okay. Okay, I'm just going to press your head just against my back hand just so I can really palpate there on the mastoid bone. Okay. Feels normal, no swelling, no lumps. So that's good. Okay. Okay. So, I'm doing a taste test next. Okay. Have you been tasting anything metallic in your tongue? Okay. Any loss of taste sensations? Okay. Open your mouth. Close. Open. What did that taste like to you? Yes, very, very, very bitter. Sorry about that. Hopefully this one will end on a better note. Okay. All right, and open your mouth, close. Good. Open. Okay, and what was that? Sweet. Yes, it was. Very, very good. And I have a few different aromas for you to smell. All right. How's your sense of smell in general? Is it pretty good? Okay. Okay. Okay, go ahead and inhale. Close your eyes. Inhale. What does that smell like to you? Lavender. Very good. Yes, it was. Okay. And this next one should be pretty distinct. Inhale. Good. What kind of mint? It was peppermint. But you got the most important part right. Okay. Now what about this scent? My favorite. Smell. Orange. Very good. Okay. All right, I'm having a little bit of fun with this because I just love these scents so much. Go ahead and inhale. What does that smell like to you? Rose. Very good. Okay, we're going to do one more just for fun. Go ahead and inhale. Woody, yes, it's sandalwood. Perfect. So, smell and taste are good. I'm relieved about that. There's no neurological issues relating to your olfactory or your taste. Okay. I'm going to just palpate your chest right now, and I'm going to be pressing down lightly on your chest. Let me know if you feel pain, okay? Pain here. Okay. Pain here. Okay. What about here? Okay. Pain. Pain. Okay, good. Just going to do some generalized measurements of the chest. Make sure that there's no lopsidedness, that one side of the chest isn't hardened. 9.5 inches. That's about symmetric. This one, 2. Excuse me, little one. And 16. Okay. All right. So next I'd like to do an abdominal exam. Your comfort animal here really likes to help out during abdominal exams, so we'll see how this goes. She might be giving us a little extra help. We'll see. Okay. All right. I'm going to start just by taking a listen. Okay, you don't have to breathe any certain way, just relax. Okay, normal regurgitation sounds. Normal. Okay, I'm pretty pleased with that. Okay. So next, I'm going to just be doing some palpations of your organs, okay? Just want to feel for anything that's hardened or enlarged. Make your liver and pelvis. Okay, do you feel any pain when I press down? Okay. Pain here? Okay, what about here? Okay, is that more of a sore pain or is it like a sharp pain? A soreness? Okay. All right, I'm going to press a little bit harder. Does it get worse when I press harder or is it the same? About the same? Okay, that must be a digestive concern, but we'll check on that later. How long have you had that kind of pain? Just now? Okay. All right, I'll take note of it and we'll press on it later and we'll see if it's improved at all. Okay. Okay, very good. All right, just doing some percussions here. Okay. My goodness. Oh my goodness. Thank you for your help, little Cindy. Okay. All right. So everything feels pretty normal. I'm going to be placing this cold globe on your stomach. It should feel very cold. When you feel it on your stomach, go ahead and say now. Good. Okay. Okay. And the same thing, except is this cold or sharp? So say cold or sharp. Good. Yes. Excellent. Okay. All right. So I'm going to go ahead and just feel your ankles and your legs. I'm just looking for signs of swelling. Any pain when I press here on the ankles? Okay. I'm not finding any signs of fluid buildup or retention, so I think you're pretty good to go here. Okay. I'm going to look at the feet right now. I'm just going to take a look at the skin. I'm looking for any signs of purple, darker in color, and also swelling, which I don't see. Go ahead and scrunch your toes. Unscrunch them. Good. Do that again. Okay. And which foot am I squeezing? Which foot am I squeezing? Very, very good. I'm going to do a Babinski response test. Okay. Beautiful. And on this one, very beautiful. All right. And do you feel a sharp or dull sensation on the feet? Say sharp or dull. Okay. Good. Okay. Do you feel this on the heel or the pads of the feet? Heel or pads? Heel or pads? Okay. Your feet look very good. Okay. I want to thank you for being so patient and allowing me to do this exam. I am going to send in my notes to the team, and we're going to determine the tests you need, because I did find some discrepancies on that left side. Some numbness, some lack of reaction or slower reaction in the eye. So we just want to stay on top of that and make sure that there's nothing serious happening, okay? How do you feel right now? Okay. Make sure to drink plenty of water. We're going to switch your IV fluid as well. And I'm going to be back in about a couple hours to check in on you again. It's going to be a more abbreviated test this time. But please close your eyes, go to sleep, okay? And have a beautiful, beautiful evening, okay?